My name is Bill Kernan, and I am the Executive Director of Pharmacy for Cleveland Clinic, Florida. Yeah, so my training, I started at Purdue University. I got my Doctor of Pharmacy degree at Purdue, and the Doctor of Pharmacy degree is pretty much, to describe that training, is a lot of chemistry, a lot of biology, but then ultimately you do learn quite a bit about all of the different medications that are used in today's practice. You do become the medication expert when you go and you get your Doctor of Pharmacy degree. After that, I then went on to do postgraduate training. So I did a residency, and I did that down at University Medical Center in Jacksonville, Florida. And that was a year where you will learn more in-depth clinical training on how medications are used, what is the right medication for the right patient, and how do we maximize those outcomes. So the residency was really, really important. And then over time, I actually went back and got my master's in business administration, which has helped me to be an administrator and a leader and a manager in pharmacy. So when I was in high school, what inspired me to get into pharmacy school was when I was in high school, I worked for an independent pharmacy, and I remember really being intrigued about medications. I wanted to learn how they work. I wanted to learn how they were made. I wanted to really learn the science behind those medications. And so that's what really got me started and wanted to move into pharmacy. And then once I actually got into pharmacy school, I then really learned a lot about how medications can be utilized to improve and help people and help patients. And so that drove me to learn even more, to be able to, again, just maximize how drugs are used to help patients. Sure, so a typical day for me, so I'm an administrator. I'm an executive director over 5 hospitals, which have 5 different hospital pharmacies, all of the medications for those hospitals. And so as a leader, I get to work very closely with other leaders within the hospital, so physician leadership, nursing leadership, administrators, and so I will meet on a regular basis with them. I'll also meet with my team as well as we work to be able to improve our services, plan new services, try to manage various different problems or challenges that may come up. So it's a combination of different types of meetings. It's a lot of meetings, but that's part of what you end up doing as a manager. And you have to do that in order to be able to move things forward and build those relationships with everybody. Now, a while back, I used to be a critical care pharmacist and a frontline pharmacist, and there I got to work directly with patients. I worked directly with doctors each and every day, got to be really at the bedside with the doctors and the patients, which was, again, really a lot of what I like to do, being able to try to help patients. And again, you're the medication expert, and so the doctors will look to you, nurses will look to you, and you'll be able to be part of that team to help them. I think the favorite part of my job is kind of going back to what I was just saying, which is where as pharmacists you are the medication expert, and there is so much that you can do to be able to help patients either be able to obtain or get access to medications, help them be on the right medication. And then as administrator, I get to help my other pharmacists be able to do that and grow those services. So it really, the number one thing that I like is just being able to use my skills and knowledge to help patients. And then the other thing that I really like is I have a great team. You can't do anything by yourself, so you've got to have a team, and I have a great team. So coming to work with my team members is something that I really, really enjoy, and the best part. Yeah, I would say to go out and, so some advice that I would give to somebody would be to go out and talk to a pharmacist, and not just one pharmacist. Talk to a pharmacist maybe that works at a retail pharmacy like CVS or Walgreens. Talk to a pharmacist that works in a hospital, and get some different perspectives about what those pharmacists do. So I would try to learn as much as I can about that, and so that would be the one piece of advice that I would give them. And then the second thing that I would say is, work hard, do well in school, do good in your classes. That goes, they've probably heard that many times before, but that is key. You've got to do well in school to be able to ultimately get where you want to go.